of the emergency?
Yes, my friend has stopped breathing, and he just fell over on me. He's all blue.
Okay, what's the address where he is?
It's 12200 125th Street. We're right in front of a grocery store.
Okay, for verification purposes, repeat that address.
You want the address again?
Yes, please, for verification.
Okay, 12200 125th Street.
Okay, and what city is that in?
It's in Largo.
Okay, and what's the phone number that you're calling from? Okay, tell me exactly what happened.
We were just sitting here on the bench talking, and all of a sudden he just fell over on me, and he's not talking, he's not breathing, and his face is blue.
Okay, I've got help on the way. My name is Andrea. What's your name?
My name is Carol.
Carol, I'm going to tell you what to do to help him. If there's a defibrillator available, send someone to get it now and tell me when you have it.
Okay. I'm here.
Okay, is there a defibrillator available?
No.
Okay, that's all right. We can still help him. The paramedics are on the way. Stay on the line.
Okay.
Okay, I need to know about how old are they?
He's probably about 50.
Okay, are you right by him now?
Yes, I am.
Listen carefully. Lay him flat on his back on the ground and remove any pillows.
He's too heavy for me. I can't do that.
Okay, what position is he in?
It's a bench.
Okay, grab them by the ankles and slide them off the chair onto the floor. Don't worry about the fall. We need to help them now.
Okay. I don't think I can.
All right.
He's just too heavy.
Okay, can you try for me?
Can I try? To pull on his ankles?
Yes, pull him by his ankles and slide him off the bench. Don't worry about the fall.
Okay.
All right, Ross, so you notice that they're prepping up because they got called for a cardiac arrest, and obviously in these times everyone needs to put on full PPE, and we also not only have to put it on, but we also have to check ourselves to make sure we're safe, because obviously COVID-19 is still out there, so we got to make sure we're donning our gear correctly.
Yeah, it's not a fun time. We've all had to dress up for a cardiac arrest and put on all our proper PPE, and just like we would if on the fire side, we got to check each other just to make sure that we don't have any open spots or anything. It's not something that it's fun to do. It's we're doing more with less resources. Having to put on the Tyvek suits or whatever our agency has for the PPE and wearing the respirators, it sucks. So one of the things that we have to do is just make sure that we understand the fact that it isn't fun, and that at least has us acknowledge the fact that it's not fun, and that way we can work forward realizing that we're all in the same boat together. We're doing more with less people, less resources, so that way we can understand what it is that we actually have to do and accomplish those goals, but we can do it together.
Definitely. One of the things you notice too, that it does take a little while to put this gear on when we arrive on scene, so not only is it stressful for us, but it's stressful for somebody who's in need of our help. And now we're waiting outside, getting dressed. It takes us about a minute to get inside before we can even start compressions on somebody. So again, we know it's a difficult time, but it's something that has to be done.
Yeah, it's something that it goes against everything that we've been taught. You know, we want to make sure that we want to get to the patient as quickly as we can, so we can provide the best possible outcome for them. But again, remember back to EMT school, we got scene safety. And that's one of the first things that we're concerned about. Is the number one person on scene is ourselves. The patient, they're going to come after that, because we got to make sure that we keep ourselves safe, so that way next person that does need to call, we're going to be available for them.
Did he fall down? Yes. Or no, he was sitting on the bench. And they asked me if I could get him on the floor.
So as we're approaching the scene, looking like a bunch of Oompa Loompas to the scene, we have to understand what the perception that we're putting off to the patient and also the patient's family. Obviously, our response time is going to be delayed because we have to put on all the PPE. We're going to start asking questions to the patient. I've been asked multiple times, why are you yelling at me? And it's not that I'm yelling, it's just that you can't hear me through my respirator that I have on. Even though I have a job that I have to do, nobody can understand a darn thing that I'm saying. So those are other complications that we have with this part of our job that luckily it's not just one or two of us, but we're all experiencing the same problems that because of having to wear all this additional equipment.
Yeah, and this can definitely be taxing on us as far as physical health, mental health. We have this. We're going to have the respirators on every call, and now we run on every patient, and they can't hear us, they can't understand us. We're constantly yelling, so it can be very stressful for us and for our patients as well.
Yeah, and I know that we all want this to be over, but we still have to follow the protocols that we have, and the reason that they're set up the way that they are is with our safety in mind, so that we go ahead and reduce the amount of exposures that we actually have to it, even though we may be asymptomatic or whatever. Reducing our chance of getting sick is more important than anything else, and then being able to provide the quality service for the patients of the county.
Absolutely.
So having a good game plan as we approach every single call is something that we do anyways. Part of every crew. I know when I arrive on scene, if I see you, that we're pretty much going to be on the same page. You approach the scene, one person goes to airway. Whether you guys want to pre-plan that, talk that out prior to getting on scene. If you know that it's a code, that's something that you can do. If you decide not to do it that way, if you guys have worked together for a long time and you know exactly what responsibilities you're going to have, then that's a different way to approach it. But at least having a game plan, putting something together beforehand, because our communication is going to not be as good as it used to be. So we're going to be yelling at each other. Sometimes try to use nonverbal cues, a little bit of pointing. It makes the MAC check and the IMAC check a little bit more difficult to perform, but that's part of the protocol. And we do have to do those either way anyway. So making sure that you learn how to incorporate that, even though the situation is going to be a lot more difficult, is something that we're going to have to go ahead and learn how to do. I think a lot of agencies have been doing pretty good with it, and we're only going to get better with the difficult situation. By the time we're experts at it, we're probably not going to have the COVID stuff anymore.
Correct. Yeah.
As you can see, going on the radio is not something that is as easy as it used to be. We have to get the mic as close as we can to our face, and then how many times have we heard Rescue 5-4, that's inaudible, and then we have to repeat ourselves.
All right. Carl, I'm going to grab you there. All right. All right, so you're 50, I'll go ahead and jump on it. All right, ready? Last set, and we'll go ahead and check. Sounds good. All right, breathe. All right, rhythm check. We're in D-fib.
Go ahead, get back on the chest.
Right, sit back on the chest.
Charging to 150. You concur, 150.
I do, 150.
We're charged, everybody clear.
Clear.
Shock delivered. Back on the chest, let's go.
As you can see there, it looked like they were yelling at each other, like, "Do you concur?" And it's not a yelling or an anger thing or anything. It's just that you get to a point where you're trying to communicate and you've said the same thing 3 times and the other people can't hear you, so you end up speaking up a little bit louder, and there's nothing you can do about it. It's just trying to have a better form of communication.
And obviously he was trying to perform an IMAC, and he was successful at it. He was able to communicate with them and speak loud enough to where they could hear him. So we want to make sure we still continue to do our IMAC and follow our protocols throughout this whole cardiac arrest.
Yeah, and it is difficult because we're in such a mode of doing things the way we've always done them, and having one person do the documentation. And now we can't have that person to the scene for the documentation. They have to stay at least 6 feet away for the documentation, or do the documentation at a later time. And that's something that is frustrating for us, especially as medics, when we have to go back and accurately timestamp everything, and have a better idea of when it was that we did things. However, providing the higher quality patient care is what our outcome is, and then having the documentation to support that. It does get a little bit more difficult because it's not in real time, However, it's understood that it's going to be the best documentation that we can, since we don't have somebody there in real time taking that documentation.
Yeah.
Alright, I'm gonna start the IO. You know about here. You know that?
Pressure.
Yep, IO already soon. Good. Yep, that looks good. Hey guys, we also got to start thinking about documentation on this. Alright.
Yeah, I don't think it's about to start looking at it.
Alright, so I'm gonna start pressing the yellow.
Alright, yellow.
Just turn it up for me so I know. I'm military mountain guy. Hey, is that you?
Hey, Chuck. Is that you, Chuck?
Yeah, what's up, buddy?
Hey, 50-year-old male is sitting here talking to a bystander. Alright, you gotta breathe, breathe. Breathe in. 50-year-old male is talking to a bystander. He, all of a sudden started to turn blue and collapse on the chairs, trying to get to the ground. No bystander CPR, we really don't do anything else. We got 2 shots in.
So one of the things that you also want to remember is, because we have that added stress to the situation of not being able to communicate, sweating our butts off because we're wearing those trash bags on us, and you know, other than looking like Oompa Loompas and having difficulty communicating with the public, that adds all that extra stress. And whenever there's more stress, people have more errors.
He's got an IO and 1 FE on board.
How long have we been working?
About 2 rounds, so about 10 minutes maybe,
Right.
altogether.
Okay, what do you
So,
want me?
breathe. I got about 1 more left. After this, why don't you take over breathing while he gets the King Airway ready.
Okay,
He's going to use a yellow, about 5'5".
okay. Go ahead and get the 2 breaths. I got everything ready, so after the next 2 breaths, we're gonna go ahead and drop it in, okay? Alright. What size are you going with? I'm going with the yellow. We estimated it to be about 5'5". 5'5", yellow. I got the OG tube already set. We're ready to go. Okay.
Breathe.
1, 2. So go ahead. Yep, I'm ready.
Don't forget about that new filter.
Okay. That's a good check on that. Got the filter?
It might be sitting in the bag. It looks like it's
right
sitting
up
in the
here by
bag.
me. Okay. I got it. Okay, you're ready, Chuck. You can go ahead and put your filter on.
Alright, we're going to breathe.
How we doing on end tidal? End tidal's slow. Alright, that's good. Let me take over for you next switch?
Yeah, after this next one, just remember now that we can just do continuous CPR, so just go about every 5 to 6 seconds on your breath.
Every 5 to 6 seconds, copy that. I'm going to advance the OG in, okay?
Chuck, when I last looked at it, we got about 45 seconds left, so just let me know. Let me know when we're at 5350.
5350, copy that.
Then we'll do a rhythm check, and I'll have you get on the chest from there. Jasmine, how we doing?
5340.
After our rhythm check, you can do another empty according to the time.
5. That's it.
Alright, rhythm check, Charlie, get on the air. Alright, we're defense, go ahead and continue compressions. We're going to charge at 150. Can we turn 1 defib? Continuing at 150.
150, you're good, Chris.
Alright. Charging to 150. Alright, we're clear. Stop CPR. Everybody clear the patient. Alright, shock in. Back on the chest.
So you guys one of the things that we want to remember is we're in condition yellow. So we're still going to be transporting the patient. So we're still working for the ultimate goal of maintaining ROSC and then transporting the patient to definitive care to a PCI facility.
Correct.
Which is exactly what we're going to be doing later on in this video. So you know, just remember that we're not gonna just call them like has been talked about in other parts of the country. So we're still continuing to work them and then transport them to the hospital as appropriate.
Correct. And that's when we get Ross, correct?
Yes.
Right. Not Ross, but Rosk.
Correct. Very similar.
5 seconds.
All right, so what is grab is lift up his chest and I'll slide the board under.
All right, rhythm check.
All right, off the chest.
Off the chest.
All right, lift him up, lift him up, lift him up, lift him up. All right,
Back on the
Back on the
chest.
chest.
Charging. Deep breath. 150. We're good. We're ready. Clear.
I'm clear.
Everybody clear? Clear. Check the limit. Check the limit.
All right.